Can I be heard?
Yes, we
All
are
right.
up and running. So welcome everyone. Thank you for being a part of Iredell EDC's Workforce Council. I'm Jessica Stewart, Vice President of Workforce and Strategic Initiatives with Iredell EDC. I'm excited to have each of you here today at the table to be a part of this conversation. The industry-led council brings together local companies with education and workforce partners. We work closely with industry by meeting with them and conducting surveys to understand their collective needs. In return, we connect them to our partners to provide resources to help them grow. We're excited to have each of you here today with us and hear from our partners, USI Insurance, and our featured guest speaker, Michael Schenk, to talk about the vaccine mandate. But first, I want to take a moment to share some of the insights from Iredell EDC's recent Business Pulse survey we released earlier this month. The survey represents the perception of businesses on the local and national business climate and helps our leaders to understand their level of satisfaction with services and specific needs and concerns. The survey was open to all companies operating in Iredell County. We had responses from 121 businesses. Most of the respondents were manufacturing, professional services, followed by retail, food service, and accommodations. Key takeaways of the survey included the outlook for Iredell County business is strong. 60% of businesses anticipate employment and sales growth over the next year. Businesses were generally pleased with the public services, providing high remarks for public safety and utilities. Organizations are pleased with the business climate in the county, noting high satisfaction for quality of life and the regulatory environment. The impacts of COVID were reflected in the concerns throughout the survey and directly associated with the national concerns, including inflation, the US economy, and the global economy. Specifically related to workforce, the top concerns for businesses was attracting and retaining talent. We're hearing broadly how difficult it is to get people to apply for jobs and retain existing employees. A remarkable number of workers are quitting jobs now. Workers that were hesitant to leave during the pandemic are now transitioning to new jobs. Wage inflation is another major concern and created a ripple effect on all aspects of doing business. This may be tied to the responses about the cost of doing business. The rising cost to attract new talent has created concerns for existing employees. Individuals that stood by their company through the pandemic are feeling left behind because new hires may be receiving benefits such as higher pay, sign-on bonuses, and retention bonuses. We asked employers about their use of local resources and grants. Many businesses did not have knowledge or had not used some of the programs. This was an indicator to Iredell EDC that we have an opportunity to raise awareness of the workforce programs available to companies. Please feel free to email me directly if you're interested in learning more. I've placed my email in the chat box. A full report of the Iredell EDC Business Pulse survey is available electronically on the homepage of our website. And this morning's topic began with a question posed by local industry. Should we mandate the vaccine, and what are other businesses doing? We reached out to local investor and partner USI Insurance to pose the question. As an industry leader, they proactively hold roundtable discussions with their clients, and this topic was not new to the organization. USI is one of the largest insurance brokerages and consulting firms in the world. Here today, we have Jason Bradshaw, employee benefits consultant, that will tell you more about USI Insurance. Thank you.
Thank you, Jessica, and good morning, everyone. Again, Jason Bradshaw with USI. I work out of our Charlotte office. So as Jessica alluded to, we are actually we're the fourth largest brokerage consulting firm in the U.S. We do operate across the country, but have local offices across the state of North Carolina, specifically here, which is an impact to local employers. We became an investor and a true partner with the Iredell EDC last year, and have really seen the value that Jessica and her team bring to the table for employers in the Iredell County region. Actually, USI, we have about 60 clients in Iredell County alone. So just some natural synergies of working with the Iredell EDC and employers in this specific geography. We've had a lot of conversation with Jessica and her team, and again, lots of questions around vaccines, mandates. What are we hearing? What are we seeing from other employers? And again, it's on a daily basis we're having those type of questions. So our job as consultants is to find resources, ways to answer those questions, whether it's around benchmarking your benefits to help you hire and retain employees, look at what other employers are doing strategically from a cost and retention perspective, and also lean heavily on our local resources such as Michael Schenk, who is our risk attorney in the Charlotte office. Michael's been with us a number of years. And before I introduce him, just kind of take everything here at a high level that we're going to talk about a lot of legislative changes and then trickle down into the vaccine piece as well. And I feel that's important because all these kind of touch each other. Legislation around healthcare, benefits, et cetera, it is always changing. It comes and goes with election cycles. So there's a lot of news out there that you may not be aware of because we're so focused on the vaccine. So trust me, Michael's going to touch on those pieces, what we're seeing from other employers as well, but some other high level information that we feel will be valuable for you as employers. Michael?
Michael, you're on mute.
Thank you. Yeah, I'm switching over shared screens here. Is that working? Well, Jason, full screen for everybody?
Yeah, I'm seeing it with the next slide to the side though.
Okay. Need to switch to a different one. Sorry. Oops. I'm sorry, I am. How about now, Jason? No?
No, not seeing the sharing at all now. It was up, it was just kind of split screen before. Here it's trying to share again. There we go. Perfect. Perfect.
Great. Thanks. And thanks everybody. As Jason mentioned, I've been a benefits attorney for a long time, over 25 years now. About half of that was in private practice with some big firms. I've been on the insurance side. USI makes a big investment in folks like us. There's 19 attorneys that we have nationwide that we collaborate and compare notes and help each other out. We have a lot of state issues that we deal with. I've got colleagues in all those high regulatory states like Massachusetts, New York, California, and so forth. So yeah, it's an interesting job to say the least. And my job is basically help my team, our employee benefits teams, generally in the Carolinas and Georgia, make sure our clients are in compliance with the benefit law. So we do a lot of outreaches and webinars and stuff like that, a lot of publishing, a lot of articles. I think we're up to 86 articles this year with developments, 114 last year. So just trying to keep all of our clients up to speed on that kind of stuff. Make sure our folks are well trained to answer most of the questions our clients have. So that's just a little bit of background of what I do and what my role is. So this is kind of a little expansive. Yeah, I'm going to be definitely talking about employers and vaccine mandates and so forth. I was actually hoping by now we would have some information out from OSHA as far as President Biden's vaccinate or test mandate. There's still nothing out as of late last night. I've been swamped this morning. I haven't had a chance to check if anything posted, but I'm sure I would have heard of something by now if it was. Again, my colleagues and I, we communicate all the time and keep each other up to speed. So nothing new on that. Still a lot of unanswered questions. I'll make a plug real quick, Jason. We do have a on Thursday, and I'm sure we can get anybody invited to it if they would like. We're in close partnership with a gentleman named Jonathan Crotty, who is a partner of the law firm Parker Poe out of their Charlotte office. He and I actually used to be colleagues. And he's going to be, we've got him coming in doing a full 1 hour webinar just on the vaccination mandates and stuff like that. Maybe something will be out on OSHA on the broad one. Y'all may not know this, maybe some of you do. There's already vaccine mandates in place for healthcare. And there's going to be, there's ones coming up on anybody that contracts with the federal government. There's a vaccine mandate there. So he'll cover some of the details of that, which the information is out already. But the OSHA one on the broad-based one for employers, 100 employees and more, still no information on that. And it's just anybody's best guess what that's going to be. So that's kind of, let me just kind of jump to my agenda, what I'm going to be focusing on today. just benefit stuff in general. What stuff is winding down? There's a lot of stuff enacted, a lot of regulatory activity and so forth that's starting to wind down. And you'll see I have question mark there because there's certain things that are subject to these deadlines, these periods. One's called the national emergency period. The other's called the public health emergency. They're two different concepts and they keep getting extended. The public health emergency for COVID-19 gets renewed every 3 months, it seems like, and probably will continue to be extended every 3 months for the foreseeable future. But it was just extended last week by another 3 months. That kind of governs over some of the mandated type stuff out there and how long you have to keep complying with that. So is that winding down or not? There's some things clearly that are winding down I'll be talking about. So what's ramping up? Real quick, I'll go over some things. This is mainly going to be a self-insured plan issue. If you're fully insured, your carrier is going to probably take care of it. But some things that are ramping up into 2022, I'll be covering very quickly. And I am tight for time, so I'm going to be talking kind of fast as well and leave some time for Q&A at the end. What could be looming? Some legislation that's been proposed. Just some interesting ideas that are sitting out there. So I'll talk about that. And then I'll close just going back through the vaccinations and options for employers. So what's winding down? Again, I'll emphasize the fact that there's a question mark up there. Number one is a COBRA subsidy. I do think this is over. I don't see this coming back. I guess you could get some legislation. I don't think it's talked about in this $3.5 trillion budget proposal or anything scaled down from that, or stimulus proposal, whatever they're calling it. I kind of don't pay attention to legislation until it's passed because just so many things can change at the last second. But I don't think you're going to see another COBRA subsidy. I could be wrong about that. It is over. It ended September 30th. Some of you may have taken advantage of that, had employees that could take advantage of that, and basically getting COBRA paid for by the federal government. And you had to be an assistance eligible individual. That's somebody who was involuntarily terminated or had a reduction in hours dating back to early last year. Actually, it could have gone even further back than that. It depended how long our COBRA period extended into. If it extended into this April 1st, 2021 to September 30th, 2021 date, people might have benefited from the free COBRA. So you had been involuntarily terminated, reduction in hours, and you can't have been eligible for other coverage or Medicare. So anybody out there who faces probably knew all these rules. There were notice requirements. Those have kind of come and gone. There were model notices. So hopefully everybody compliant with those to the extent they needed to. So we're kind of now in still a stage of documenting and getting your tax credits. And what most people had to do is the employers would front the COBRA subsidies. They'd pay the premiums directly to the carriers. If they were self-insured, they just keep the coverage in place for free. And then, you go get your money back from the federal government. And the main way you did that was retaining payroll tax remittances. So you were scheduled to remit $5,000 to the IRS for payroll taxes, but you got $4,000 in money that you fronted for employees for free COBRA, former employees. You can hold back, only send $1,000 in. So I'm guessing everybody who's facing this has understood that. Some people thought, no, you can't really do it until you file your 941, and that's fine. It wasn't really a requirement, but some people are just waiting and then just reconciling when they file their Form 941 quarterly. I haven't heard of any situations where any employers paid out more in free COBRA than what they had incurred in payroll taxes. But if that happens, you could still get an advance payment by filing a separate form. And one other thing, you can only seek a tax credit for the full COBRA premium to the extent you didn't already have a commitment to chip in for somebody's COBRA. No good deed goes unpunished, right? We had a couple of our clients that had already committed, we had to involuntarily lay you off and so forth. But one of the things we're going to do is we're going to pay 75% of your COBRA premiums, just like we used to do when you were an active employee. We're going to pay 75% of that. Well, if you already had committed to that before ARPA passed the COBRA subsidy, you're only entitled to a tax credit of the 25%. You had already committed. Again, not terribly fair, but like I said, no good deed goes unpunished. But the verification, keeping your documentation that people certify that they were eligible for the credits. Important to keep that just in case the IRS comes knocking to confirm that you're eligible for that. So that's the COBRA subsidy real quick. Couple other items I'm going to cover very quickly is just some stuff that's sitting out there, but it's kind of coming to an end. It's somewhat extending into 2022, but it might be something you have to make some decisions on. I can tell you we've had very few clients that have taken advantage of some of this new flexibility that was temporarily allowed for health FSAs and dependent care FSAs. But, giving people an extra year of up to pretty much an extra year of time to use money that they had set aside for health expenses or dependent care expenses and ended up not being able to use. Going into the end of last year and the beginning of this year, we were into the depths of COVID, and I don't think a lot of people were making mistakes or, caught by surprise that they couldn't use their money. I think that's why a lot of people are not taking advantage of these, but these are coming to an end. We have information on that. If you're interested, how it could still work. If you have some employees that have some big balances and FSAs and they can't use them and you want to kind of give them a break to continue using that money, you can do that. And we can help you facilitate if that's necessary. Just a couple other things, more flexibility that you're allowed to give with health FSAs and dependent care FSAs. Like dependent care, usually it has to be expenses incurred for a child who is no older than under age 13. Once they hit 13, the dependent care expenses for a 13-year-old, you weren't really allowed to get reimbursed on a dependent care FSA. They changed that to 14. That's just temporary. That's coming to an end in case you're taking advantage of that. And then just mid-year election changes, you could offer a lot of flexibility in letting people make mid-year election changes on health FSAs or dependent care FSAs. That's coming to an end. And then just health coverage in general, you can still through the end of 2021, and I think it's through the end of plan years and end in 2021. So for calendar year plan 12/31/2021. You can give flexibility if you want. Again, we're not seeing a lot of clients do this, but they'll come in with situations and say, look, we kind of feel for this employee. We want to let them make a change in their election mid-year, but the cafeteria plan rules, it doesn't really fit one of those qualified life events, as my teams like to call them. I said, well, you could just go ahead and take advantage of this and pick up this employee, but if you offer it to this employee, you kind of have to offer all your other employees as well. So I think that might be a reason why people aren't too crazy about that. Dependent care FSAs, calendar year 2021 only. Instead of a cap of 5,000, you're allowed a cap of 10,500. We have had a couple of clients take advantage of this. You got to do a plan amendment. One of my concerns on this is dependent care FSAs are the #1 plan that typically fails non-discrimination testing. And it basically means you've got one or two, it depends on your size, maybe a dozen highly compensated employees. And that's people making $130,000 or more. So pretty big number. But if you just have one or two people in that category taking advantage of the 5,000, let alone 10,500, you're going to probably fail that testing. So, and those are the ones that tend to have more ability to afford 10,000, putting 10,500 away as opposed to 5,000 or less. So anyway, and one other observation, that there is a budget proposal that would extend the 10,500 limit and actually apply a cost of living adjustment to that every year. So maybe something to look forward to, but I'm not seeing a lot of traction on this, but a few people have picked up on that. Next is just something that kind of a reminder that's still sitting out there. And it's the deadlines that you think you can impose against employees under COBRA, under HIPAA special enrollments, and basically on run-out periods if you have a health FSA or HRA. And it's basically a situation, employee wants to go do something related to COBRA, or they want to do something related to an enrollment, mid-year enrollment because of various reasons that qualify under HIPAA. And you said, no, there's a deadline. You had 30 days to do that. You had 60 days to do that. You had 3 months to do that. You missed your deadline. Sorry, you're out of luck. Chances are you cannot apply that deadline to that employee. You have to give them an extension. These outbreak period rules came out May of 2020. They've been out a long time. And they keep getting extended because these are tied to the national emergency, not the same as public health emergency. This is the national emergency. President Trump established it early last year. It was, it's set for 1 year, March 1st to 2/28 of 2021. President Biden, one of the first things he did, he extended, and he said it still exists, which means it's basically extended for a year. So we're out to end of February 2022 of the national emergency. And that's what this rule applies to. So it's still sitting out there. Again, the key thing to keep in mind is if you think you can impose a deadline under COBRA, you think you can impose a deadline saying you missed it as far, and COBRA would include COBRA election, COBRA initial premium payment, and subsequent COBRA premium payments. Everybody basically gets a 1 year extension on all that. And they can just sit out there, and now you'd probably want to cancel their coverage and not pay claims. But if they come in, they elect it, they retroactively pay their premiums, you got to go back and process those claims. So it takes some coordination with your carrier or your stop loss carrier or whatever the case might be. But in any event, if you think you can apply a deadline, chances are you can't. There's a few situations like a new hire, you hired them today, they've got until the coverage is going to go effective December 1st. They got to notify you by November 15th, and they missed that deadline. That doesn't fall under this. You can keep that deadline in place and said, sorry, you missed it. We told you. We'll see you at open enrollment, which probably January 1st anyway. So not much of a big deal there anyway. So just a reminder that's still sitting out there. I've had this hit. We put a lot of information. We still have clients that get caught by surprise on that. Next is planned coverage COVID-19 testing. This is something that is tied to the public health emergency, and the public health emergency gets renewed every 3 months. Again, a week or two ago, it got extended. It currently through January 16th, 2022, all plans have to cover COVID-19 testing. But keep an eye here on what it does not, the mandate doesn't include. It doesn't include treatment of COVID-19 related issues. For a while, carriers and self-insured plans in the early stages of COVID were covering COVID-19 treatment at 100%. I think pretty much all the carriers have backed away from that. They're not, they're not doing that anymore. And that's fine. But also testing for travel. I've had to deal with that myself. Testing for general workplace health and safety, such as return to work programs. The plan does not have to pay for testing in those circumstances. And as far as the OSHA mandate, whether the plans have to pay for that, the way the rules are reading right now, no, they don't. Of course, the big question is if the plans don't pay for it, who does, employer or employee? But so we still have this testing mandate in place, and at least through early next year, and that'll probably be extended again. I wouldn't be surprised if we see that extended at least once or twice in 2022. Next is coverage for vaccines. I say winding down, this isn't winding down. This isn't going anywhere. I just felt like I had to put this in somewhere. It's essentially permanent. You may know if you have a non-grandfathered health plan, you have to provide all the preventative services recommended by the recommended A and B services recommended by some agency. I forget the name of it. And this falls under it. The COVID-19 vaccines fall under that. And if you have a non-grandfathered plan, which is probably 95% of our clients, you're kind of stuck with this. And not, as you know, as of now, the federal government is paying for all the vaccines. The plans have to pick up the cost of administration of the vaccine, but that's basically fixed at a cap of $40 per administration. So hopefully you're not seeing big increases in plan costs or anything like that dealing with COVID-19 vaccines. And I think most people agree it's money well spent. Getting folks some, a choice between a bunch of unvaccinated people versus a bunch of vaccinated people that you'd have to pay for. Some of those unvaccinated, everybody can obviously get COVID, and I don't mean to be political or anything like that. But I think, I think on average, plans are going to save money the higher the vaccination rate of their employees are as far as COVID-19 treatment. So just my personal observation there. And on this, on a network, even out of network, you have to continue paying for the vaccine administration. Again, the vaccines are still free. I don't see that changing anytime soon. But if for out of network, you can actually cut that off once the end of the public health emergency. Again, something tied into the public health emergency, something that could be winding down. It hasn't yet, but that's only for out of network. In network, you'd still have to cover it at 100% indefinitely. So next, telemedicine flexibility, telemedicine and HSAs. This is relief that's coming to an end at the end of this year for calendar year plans. For plan years that began in 2021 or before 2022, anything you did on telemedicine, if you let people do telemedicine for no cost or nominal cost, $5, $10, arguably that makes people ineligible for HSA contributions if they have HDHP coverage, but that you kind of got to pass on that. But that's coming to an end. So if you implemented this, you might have to undo that and make sure when it comes to telemedicine and just remote care. I had some vendor the other day that actually will provide at-home care. They'll bring doctors or PAs or something like that right into people's homes. But you're doing that at a cost below fair market value. There's a subjective term for you. You're doing that for less than fair market value. That should technically make people ineligible for HSA contributions. That said, I've seen plenty of telemedicine that they're ignoring it or whatever. But anyway, and there is legislative proposals out there to extend that indefinitely. So kind of have to wait and see on that. Next is standalone telemedicine. Most people offer telemedicine with anybody that's already on their group health plan. But if you offer telemedicine to people not on your group health plan, that telemedicine offering probably violates the ACA. It doesn't include all the mandated stuff you're required to have. For example, free preventative, including colonoscopies. You cannot do a colonoscopy via telemedicine. So the odds are, if you're only offering a set of employees not on your group health plan, but you're offering the telemedicine, generally that's illegal. You cannot do it. It doesn't comply with ACA. But we got a break on that for a while. It's only large employers. It's based on whether, last year you averaged 50 or more full-time equivalent employees. So anyway, that is extended for a little while, but only to the end of the public health emergency. And there is a bill on that making that relief permanent. So we have to wait and see on what happens there. One other thing I just thought I'd mention real quick. Some of you may have heard about this. Blue Cross Blue Shield. All the Blue Cross Blue Shields around the country got sued several years ago for antitrust claims and different things that we're doing. The biggie there is that they agreed to pay out a big settlement to all harmed individuals and companies. $1.9 billion. I know that sounds like a lot of money, but that's getting spread around everybody that was in insured plans anywhere in the country by one of the Blues from 2008 to 2020. So 1.9 billion doesn't go as far as a lot of people might think. Nonetheless, I personally, individuals can file claims. I got a postcard that gave me a unique ID number. I went online, took me about 5 minutes to go ahead and file a claim. I'm expecting $2.42, something like that. But there is a deadline coming to file a claim. November 5th is the deadline, so it's coming up very quickly. You can file online. Most employers we work with are just going with the defaults. Basically, we understand we as the employer get for single coverage, get back 75%. Ours is based on as if we chipped in 75% and employees chipped in 25%, even though it was maybe 80-20 or 79-21 or something like that. They're just, because to prove otherwise is just a big pain in the neck. But anyway, there's a really, I got a link there. And by the way, we can get these slides out to everybody after the presentation, but there's a really good website, gives you all the information that you need. But the key thing there is you got a November 5th deadline coming up if you haven't done that. So what's ramping up? Key thing is consumer protections, and pretty much a lot of stuff that was supposed to start brand new in 2022. We've gotten a reprieve on most of it. A lot of stuff has been delayed. some by 6 months, some by a year, some until further guidance is issued. And again, if you're full, I mentioned at the outset, if you're fully insured, your carrier's taking care of all of this. You really don't have anything to do. There might be something on the broker transparency that I'll get to, but you really don't have to do anything. If you're self-insured, you need to work with your broker to make sure your TPA is going to be on top of handling all this stuff for you. It would be impossible for you to do all this stuff. In fact, you probably can't do any of it. And the first one that comes up is the No Surprises Act. No surprise billing is a federal one. A lot of states had already implemented something like this, but it's those emergent, you have an emergency, you just go, you get an ambulance from wherever, maybe an air ambulance, a helicopter. It sends you to a certain hospital. You really don't have the ability to evaluate whether it's in network or out of network or anything like this. You're just going to get the emergency services, and ends up being out of network. Claims get processed, all this other stuff. And you get a balance bill for a huge number, and it's going to bankrupt you probably. These are designed to get around those. So it's emergency services, but it's also non-emergency services. Like, for example, you're going in for hip replacement, and your surgeon's in network. The facility is in network. But one thing you didn't realize is the anesthesiologist that's in there, not in your network, and you had no choice over this matter. They have ways of helping you out in those situations. The patient won't get hammered. What the question mark is, how much will the plan have to pay? And that's where we're coming from, a self-insured plan. Heck, I don't want some arbitrary number. And it's really, these are designed to stop gouging by out of network providers. So I don't think it's going to be bad on employers as they think. There's a system in place for how you determine what's a fair amount. It might come down to arbitration, where you have an arbiter. You get the proposal from the plan. This is how much we think it's worth. The provider says, this is how much we think it's worth. The arbitrator looks at the two numbers, has a base number that's already sitting out there. They're supposed to choose the one that's closest to the base number. And only extreme circumstances differ from that. And so there's some fees involved. I don't think you'll see many claims get to this point of independent dispute resolution. 99.9% of them are going to go smoothly. But once in a while, you might just have your plan, self-insured plans, where an arbitrator picked the provider's number and it was a little bit higher than you were hoping for. So just, that's kind of what's going on there. Health plan coverage transparency, new disclosure requirements, internet disclosure on in-network rates, out-of-network rates. Employers have no prayer of being able to post this. This has already been delayed for 6 months. I think it's going to be delayed further, but a bunch of machine readable files that have to be uploaded with all of these rates and stuff like that. It's going to be a pain, but you got to rely on your TPA to handle that. Technically, the plan sponsors responsible for it, but I know we're making sure all the TPAs our clients work with are going to be up to speed, and you should be counting on your broker to be doing the same. And price comparison rules. Yeah, I gotta keep moving. Pharmacy cost transparency. This has been pushed back 2 years. So you can see here what has to be reported as far as pharmacy benefits and costs. You'd have to have coordination between you as an employer. You'll know certain things your TPA or your PBM won't know about, but you'll have to coordinate information on that. But that's being kicked down the road a little while, so nothing to worry about there. Increased transparency for consumers. New ID cards to include deductibles and out-of-pocket maximums. You do not have to create new cards. You can just provide an electronic card, and the electronic something people can access online, and that has that information on it. That's all you really have to do there. So that's pretty simple. In advance EOBs, these have been deferred indefinitely. Price comparison guides have been deferred to 2023. Provider directory updated every 90 days. There you have to show good faith compliance, pretty much starting right away. So hopefully your TPA will ramp it up a little bit about keeping provider directories updated. I've been a victim of that situation before. I went online, this doctor's in network. I called the doctor's office. Are you still in network with this such and such carrier? Yes, we are. And then sure enough, I get an EOB saying it was an out of network claim. So hopefully, and they were literally out of network for one day is what they told me. So kind of bizarre. But all these things designed to be good for consumers and pro-consumer. And yeah, a little bit work more for TPAs. You're going to probably see your TPAs propose higher fees to help comply with all these things. I saw one carrier, they were going to charge $1 per employee per month for compliance with just the No Surprises Act. At the end of the day, my conclusion is that's a little expensive, and maybe more costly than necessary. And maybe the other option was just do it case by case whenever they came up. I don't think it's going to come up that often. That's why I didn't think the dollar was very reasonable, but that's certainly something for you to check over with your consultants and so forth as to what you think. Broker compensation transparency. If you're working with a broker or consultant, they have a lot more responsibility on being transparent on what they charge for direct, indirect compensation and so forth. USI as a broker, we're very, very ramped up for this and ready to help our clients be compliant. And hopefully your broker's in the same boat there, but this is more of a burden on the brokers. And, you can actually file a complaint if your broker to the DOL, if your broker isn't meeting these requirements. And this is coming up soon, first of next year. Mental health parity comparative analysis. This is just another thing. If you're self-insured, something to deal with your carrier. Mental health parity is becoming a big deal. If you're a larger employer and self-insured, hopefully your TPA is kind of getting up to speed with the new enforcement activity going on here. And these rules are not new. It's just they're being enforced more, and people have been lazy, and they need to quit being lazy and kind of ramp up on these. So what could be looming? Real quick here, some proposals that are out there: electronic filing of 1095Cs and 1094C for companies of all sizes. Before, if you had less than 250 returns, you didn't have to file electronically. You could just file manually. They're looking at rolling that all over and stuff. We are expecting some wellness rules. We work with a lot of companies with wellness programs, and the ADA, the EEOC has their foot in this a little bit under the ADA. We're expecting some new regulations there, but we expect those to be pro-employer. More to come on that. And the budget bill, make permanent the expanded ACA premium tax credits under ARPA, like getting rid of the 400,000% of poverty level cap for people who would qualify for premium tax credit, adjusting the employer affordability to flat 8.5% with no inflation adjustment. That could impact employers a little bit, and they have to increase their costs on how much they have to chip in for coverage to make it affordable. And then premium tax credits to low income individuals, despite employers offering affordable coverage. So these are all designed to really make tax credits more widely available. Some of that might impact employers a little bit with greater risk of employer mandate penalties, but probably not too bad. Having a federal paid family and medical leave, 12 weeks paid at 2/3 wage replacement. We've been blessed to be down here in states that don't have state paid leave laws, but we may very well be facing a federal one here before too long. Civil penalties for mental health parity non-compliance, and then extending that 10,500 on dependent care FSAs, as I mentioned before, that's in the proposal. So, just real quick, preparing for 2022 and beyond with what I've talked about so far. The Blue Cross, November 5th, don't forget that deadline. Finish up your stuff on the COBRA subsidy if you had any of that, and claiming your tax credits, and make sure you kept your good documentation there. Continue providing COVID-19 coverage for COVID-19 testing and vaccines. Follow the required deadline extensions, that outbreak period rule that I went over. Make sure you understand it, and hopefully your vendors know to recognize it when it happens. Again, you think you can impose a deadline under a mid-year enrollment, under COBRA, something like that. Chances are you can't. So I've just directed all our clients, you think it doesn't apply or does apply, just call us, we'll confirm it and explain it better. Prepare for those other changes in 22, review your TPA's involvement and all that. Mental health parity I mentioned, get ready for charging for telemedicine. and then watch for further legislation, guidance, and developments. So that's a very quick rundown on that. So I do want to go over what's up with COVID-19 vaccinations for options and employers. I don't know. I'm doing a time check here, Jason. What the
I think we're still good. I think we're
Okay,
still
good.
okay.
Yeah, this is just about 4 or 5 minutes. The first thing we were hearing about right after the vaccines were announced from employers is, hey, can we just make people get vaccinated? You know, we think it's different cultures out there with different employers and so forth. But we did have a lot of employers. Can we just make people get vaccinated? And the EEOC came out with guidance. They update their guide. They have some really good FAQs. They update them all the time. I think they updated them just last night on religious exemptions. But the EEOC has said, yes, you can mandate vaccines with just 2 exceptions. One being is if a person's disabled, they really cannot get the vaccine, or 2, they have a sincerely held religious belief. Very subjective terminology there. You know, if they have either of those situations, then you have to provide them a reasonable accommodation. Now, if somebody comes in and just says they don't have any medical issue, they don't have any religious issue, they just don't want to get vaccinated, they're done. They're out. I mean, you can terminate them. You do not have to make any reasonable accommodation. You don't have to do anything for them. They're out. That's not easy to do these days. I talk to an employer every single day who's having difficulty finding employees. So you all of a sudden do this. Not only are you not finding new employees, you're losing even more of the current employees you had than what, you're losing more than what you would bargain for. But if you do, if somebody comes in and says, yeah, I have a medical situation, or I really feel deeply about this with my religion and so forth. I do not want to get vaccinated. I will tell you, one of the obvious reasons for not getting vaccinated is you've had it recently and you got the antibodies, and it's not, I don't think it's necessary from everything I've read. So for those folks, you give a reasonable accommodation, and the EEOC is given specific examples in the guidance. Make people wear face masks, make them socially, and you can do all of these things, make them socially distanced from each other, make them work a modified shift. I'll come back to testing, opportunities to work from home, opportunity to accept a reassignment, get assigned to a different job where you're exposed to, you're isolated or something like that. But one of the things they expressly said right at the beginning of the year is make them get tested periodically. Of course, their guidance didn't say anything about who has to pay for that. I can tell you there are some state laws. I don't think it's anywhere down in this area, nothing that I've heard of. There are some state laws that would require, I think New York's one of them, that if you have any requirement as part of the work job, part of the job requirement for an employee to spend money, the employers have to reimburse for that. But to do a mandate and say, well, okay, fine, if you're not going to get vaccinated, you've got a medical excuse, you got a sincerely held religious belief, fine, we're good with that. But we need an indication of a negative test once a week. Actually, I think the federal contractors are required to show a negative test twice a week. And testing kits are not easy to get. If you allow them to just use a self-test, I've used some of the self-tests. I think they work very good. And of course, I've been negative tests all the time, but and they can be cheap. I've gotten a two test kit for as little as $20, so that's about $10 a test. But that's one of the things you've always been able to do as an employer is either, yes, you have to get vaccinated, fine, you're not going to get vaccinated, you have to test then. And so anyway, outside of so the second kind of phase we got was, okay, outside of a group health plan, I'm getting to that in a minute, can we incent people to get vaccinated? And you heard all the stories. Kroger offered a $100 bonus, and I think Boeing was offering an extra PTO day if you showed you got vaccinated. And it's in all the issues I've dealt with, it's always we're going to do a raffle. No, I've seen plenty of those as well, of everybody that's vaccinated, they get entered in. And if all you're doing is just show me something, proof that you've got it. And obviously the easy thing to do is show your CDC card that you've gotten both your Pfizer's or Moderna's or got your one Johnson & Johnson. Just show your CDC card. That's all you require the employees to do. You can even incent people to have their family members vaccinated, spouse, children, stuff like that. And so it's ideal that all you're doing is asking them to show proof. If you're actually administering the vaccine itself, I don't know any employers that have done this. The vaccines aren't that easily accessible, stuff like that. There's some other rules that apply, but on these incentives, there are no limits. I mean, you could offer people $50,000 to show proof of vaccination. I'm trying to think of the biggest incentive that I've seen. A few $100s, I guess, $250 or something like that. But keep in mind, if it's cash, it's bonus, PTO days, and gift cards, technically that should be treated as taxable income. If it's a bonus, obviously you're going to run that through payroll. But so that's kind of where the EEOC is on that. And I don't think that EEOC, this is my personal opinion, I don't think you have to, if somebody comes in, hey, I have a religious exemption or I have a disability exemption, give me the incentive anyway. I don't think you have to do that. Maybe double check with your own legal counsel, but I don't think the guidance suggests that you have to do that. So about 3 or 4 months ago, the hot new thing was, hey, wait a second. These unvaccinated people that are on our health plan, they have a bigger risk of incurring some big claims from having COVID. Can't we charge them a higher premium if they're unvaccinated? And our initial response was, yes, you can, but it's probably going to fall under HIPAA wellness rules. If you cannot discriminate against somebody based on a health condition, is being unvaccinated a health condition? I don't know. Having COVID, so anyway, this was later confirmed with some DOL guidance that you did need to follow these HIPAA rules on health contingent activity only wellness programs. They have 5 main requirements. The 2 that really matter the most is how much of a surcharge you can charge and whether you have to give somebody who remains unvaccinated some alternative way to avoid that surcharge. So the 30%, everybody probably heard about Delta Airlines, $200 a month. And they had no other wellness programs, and people have confirmed that. So $200 cannot exceed 30% of what the individual health insurance premium is under their plan. They probably use COBRA rates, and that's probably $700. 30% of 700 is 210. That's probably where they came in with the $200 amount that they were charging. And they got a lot of pickup on people getting vaccinated under their plan. So there's this 30% limit. If you already have a health contingent wellness program where you're already giving people, $50 a month reward or $25 or $100, that counts in the numerator of the 30%. So if you want to add in a surcharge on top of that, you got to add all those together to make sure you're staying within the 30%. The other thing is you have to provide a reasonable alternative standard for unvaccinated people, but like only if they have a disability or a religious exemption on the mandate itself. Here, if you're, you only have to do this for people who, the reason, I'm sorry, should put that on to start. You only have to provide that to people who their reason for not getting vaccinated is because they have a medical condition or it's been medically advised that they not get vaccinated. It might be somebody who just had COVID, for example. So those are the only people that you have to provide a reasonable alternative standard to. And a reasonable alternative standard is very similar to reasonable accommodations. And so, somebody comes in and I have a doctor, I'm pregnant. My doctor does not want me to get vaccinated. And you show that, and just based on that alone, your reasonable alternative standard that somebody else has to do instead is probably nothing. It's like, fine, you're good to go. You don't have to, we are not going to charge you the surcharge, but maybe, a month or 2 after the baby is born, we're gonna have to reevaluate this a little bit and make sure that's still true. But providing a reasonable alternative standard, what's not clear is whether you have to provide a reasonable alternative standard available for somebody who has sincerely held religious beliefs. I'm inclined to think it's not required. It's not a mandate. It's just, you don't have to get vaccinated. It's just, if you don't, we think you're going to cost our plan more money, so we're going to charge you more money. Kind of like how smokers on marketplace coverage have higher premiums, at least in most states, than non-smokers. I mean, smokers cost plans more money. Unvaccinated people probably cost plans more money. They should have to absorb some of that. So if I will say, if you're not going to provide reasonable alternative standard for somebody who has a sincerely held religious belief, and still charge them as a surcharge, maybe run that by your legal counsel, make sure they're okay with that. So anyway, one thing to keep in mind that any surcharge on the employee premium amount, that'll change how much you have to use as your premium for determining whether your coverage is affordable under the ACA. So anyway, that's kind of a quick nutshell on up until now. And then, as you all may know, this path out of the pandemic, Biden's proposal, only employees with 100 or more employees. We think that's on a control group and multi-location basis. You have 15 here, 20 here, 200 here. All those locations are subject to the rule. We think that's how it's going to play out. It is our understanding that if you do have an employee who is clearly a work from home employee, there's an exception for them. They don't have to be, they're not subject to this vaccinate or test rule. Also part of the proposal is to provide PTO to obtain the vaccine and recover from the side effects. And like I mentioned, it goes company wide. One thing that's not clear yet are temp agency workers that are working in your location. They're not nominally your employees, but they're working for you at your location. Yeah, we'll have to wait and see on that. Just a lot of unanswered questions. The penalty is pretty severe, upwards of $14,000 per violation. Everybody knows we're waiting for guidance. A lot of people, one of my theories why this might get dragged out before implemented is because of the availability of testing kits. And people have tried to get them individually. They're hard to get. I've called vendors that'll sell them in bulk, and I think they're gouging people like, what is it, Bionex now from Abbott. I bought it for, again, $20 for a 2-test kit. These in bulk people are charging like $100 for a 2-test kit, $50 per test. And, they're just getting access to supply, and I think they're gouging people. But in any event, the efforts are designed to give better access to tests and get the costs way down, approve more testing vendors with the tests that they have. We don't know what's going to be required. Is a self-test okay? Or, is an antigen test okay? We don't know that either. And then, of course, key unanswered questions: must employers pay for it, including paying employees for time spent testing? And will health plans pay for these tests? I really think if it does fall on employers, this is not going to be as big a ticket item as a lot of people are concerned about. I think they are going to allow the self-test kits. I think the cost of those are going to get down to about $6 or $5 a pop. So you're a 400-person group, you got 25% unvaccinated, that's 100 people a week you're testing at $500 or $600 or $700 a week. I know you don't want to spend that money, but that's my guess. I could be entirely wrong about that. We'll just have to wait and see. So that's all I had, and I can certainly open to any questions and try to answer those to the best of my ability.
Thank you so much. I really appreciate lots of information and lots of just things to take back and take away. I want to make sure, was there anyone in the attendees that had questions for Michael or Jason today?
Jessica, we did have 2 questions come in. And good morning, everybody. So Michael, first question, if an employee is released because they have not complied with a vaccine mandate at a company, is that former employee eligible for unemployment benefits?
Outside my area of expertise, I would say try to sign up with the Jonathan Crotty's webinar on Thursday. My guess is that he would address that. And if he doesn't, I will ask him the question, because I've gotten that question before. I can tell you unemployment laws are state by state. They differ state by state. I've seen situations where people have applied for unemployment, and they let the employer give their side of the story. Clearly, this was not an involuntary termination. It had nothing to do with COVID. They were just a underperforming worker. And sure enough, they gave them unemployment coverage. And, for a while, they were really liberal about that. I just, my guess is that it's a coin, the answer is a coin flip. You just don't know what you're gonna get from the state unemployment agency. And, you know, I'd say state by state. I would venture to guess in Southeast states, they're gonna be more pro-employer, if you will, and probably not allow it, but it's a great question. I know I kind of circled around it but I'd say your guess is as good as mine.
Fair
And I
enough.
think Jonathan would say the same thing, but good question.
Another question came in. If a third party comes to your site, does this equate to the company itself administering the vaccine?
I would assume yes. I would assume yes. I have not had that question. But yeah, if you're coordinating the administration of the vaccine at your facility, I think you need to go to this, and you're incenting people to do that. Okay, you're bribing people to come in and do that. You have to be a little careful, and you can go to the EEOC guidance. And so the EEOC FAQs, they've got like A through K, and then multiple questions under each of those letters. I think if you go under the K, I think these are all under K, and that was recently updated just yesterday. They explain it off the top of my head. I mean, it has to be, the amount of the incentive is it's still subjective, but it can't be too significant, whatever that means. I mean, I would think a $25 gift card would be no problem. $125, $200 gift card, okay, that might be getting out there a little bit. If all you're asking for is that CDC card blanc, but if you're administering it, it might give a little more guidance as to what's considered, you know, the employer administering it. But the way it sounds, I think that would be, you know, you're setting up an agent on your behalf to come in and do it for your employees at your facility. I've never seen anybody do that yet. I don't know. Our population health and management people keep up on vendors. Jason, do you know if PHM folks have lined up with any bulk vaccine administrators at all yet?
That's a great question, Michael. And I've had a couple employers ask me for those resources. It is still, it's a supply and demand thing right now. And regionally, we're still not seeing much outside of the large hospital systems. So if they know Vaughn or Atrium, or my questions have come from the far west Asheville area, hey, does a mission hospital have a clinic that they can bring out, bus, et cetera, set up and do this at our employer location? That's what we've seen so far. LabCorp is always kind of in that niche space because they've done the on-site flu clinics, et cetera. Personal experience, they do a great job at that. They are stretched way too thin, I would think, to deem them reliable at this point.
Yeah, I can tell you, I mean, it's called What You Should Know About COVID-19 and ADA Rehabilitation Act, under the EEOC website. And I'm just looking at, yeah, like I said, I think it's more than that. Okay, there's a lot of FAQs that they have. But K, you know, titled Vaccinations Overview, ADA Title 7 and GINA. Yeah, I don't want to take too much time, but I know it's in there on the incentives. Yeah, I'm sorry. It's in there. I think it's like K11, K12, something like that. It fleshes it out a little bit. Employer K16. Okay, here we go. The ADA does not limit incentives an employer may offer to encourage employees to voluntarily receive the vaccine or provide confirmation of vaccination if the healthcare provider administering a COVID-19 vaccine is not the employer or its agent. It's that or its agent that is a little troubling. If you bring in a healthcare provider, is that the employer's agent administering the vaccine, and bring him to your own facility. I just get concerned that borders over it. So just, maybe double check it, or just keep your incentives kind of modest. Here's the language they use. When the employer or its agent administers a COVID-19 vaccine, the value of the incentive, which includes both rewards and penalties, may not be so substantial as to be coercive. So that's pretty subjective. Like I said, 25, I don't think is too coercive, but $1,000, yeah, that's pretty coercive.
Well, thank you so much for your insights and information. I think our guests really found it informative. Thank you all that joined us today. I have placed Jason as well as Michael's email in the chat box. So if you would like to reach out to them directly with questions or more information about USI, Jason will also be following up with the group directly with some additional information, and I will be sharing the webinar with those that attended today's event. So thank you so much. We appreciate all of you attending today, and thank you, Jason and Michael, for your time. Y'all have
Thank
a
you,
wonderful
Jessica.
day. Thank you.
You too.
Thanks, everybody.